lecture is Communicative Skills of Dental Team Members, the role of dental assistant in hygiene education, generally accepted norms of communication in the dental clinic, the concept of subordination, dissatisfied patient, and response to complaints. Lecturer Dr. Mariana Levkiev. Lecture outline. Role of dental assistant in providing oral hygiene education to patients and assessing of patients' oral hygiene habits. Oral hygiene items, their main properties and way of dental assistants are often described as the dentist's right hand. They are vital members of the dental team who ensure that you are cared for in an efficient manner, a super clean, germ-free practice. But the exact duties of a dental assistant vary from state to state, province to province, country to country. In places, their role is to help with any tasks that don't require a dentist or a dental hygienist certification and training. Many dental assistants, called dental nurses in the United Kingdom and Ireland, have both clinical and administrative skills and responsibilities. This means they help the dental practice run smoothly and efficiently. They are also directly involved in certain parts of patients' oral health care. Care at home and regular checkups form the bedrock of preventive dentistry. Professional dental assistants are aware that there are a number of other ways that teeth and gums are actively protected. For example, another important component of dentistry is oral hygiene education. This can be a lifelong process for individuals. If an individual gets braces, for example, then their routine may also need to be modified. Even seniors may need to relearn how to carry out their oral hygiene routine if they get dentures or if another change device.
Effective communication in healthcare organizations. Effective communication is an essential element for providing safe patient care that occurs when a message is exchanged between two or more people. The essential elements of effective communication. The sender must deliver a clear message, and the receiver must actively participate in understanding the message. Barriers to effective communication. Language differences, cultural differences, physiologic barriers, cognitive impairment, emotional barriers. S-bar communication. It's a tool that provides a framework for communication between healthcare teams that helps to reduce the risk of patient care errors. S-bar communication breaks communication down into 4 steps. Situation: what is going on with the patient? Background: what is the clinical background? Assessment: what do you think the problem is? Recommendation: what would I recommend?
Importance of communicative skills of a dental assistant or nurse or a member of a dental team. The importance of communication skills and tailoring communication to the individual cannot be underestimated. The need to consider the patient is principal, be they a child, adult, or adult with special needs. Good communication makes life easier by facilitating the building of patient rapport and trust, thus helping to reduce patient anxiety whilst enhancing patient satisfaction and compliance. All of this contributes to a better patient experience and an improved experience for the dental team, as well as minimizing misunderstandings and complaints. Collaboration with coworkers. Communication skills can impact the relationship that you build in the workplace. As a part of a team, you can prioritize good communication with your coworkers. Knowing how to express yourself can allow you to share your expertise to contribute to the team's work. You can also resolve interpersonal conflict and foster trust to make collaboration easier and more productive. For example, if you are working with a coworker who's new to the company, you can talk about their department's policies and approaches to projects. Your coworker may appreciate that you are upfront about how to complete the assignment and you are dedicated to showing them how to be successful. Oral hygiene education of patients and assessing of patients' oral hygiene habits. Hands-on oral hygiene demonstrations keeps patients engaged and are particularly effective when teaching new techniques and working with children or the elderly. Assessing what patients learned is as easy as asking for a 10 demonstration. Patient education. Oral hygiene is not just about a pretty smile. It's essential to good health. Research shows that conditions affecting the teeth and gums are far-reaching and can affect the heart, kidney, and brain. From demonstrating brushing and flossing technique to reviewing the role of smoking and sweets in oral health, a significant part of a dental assistant's role is to provide patient education. A healthy mouth supports a sound body, and it all begins with knowledge. What is oral hygiene? Oral hygiene is the practice of keeping the mouth clean. Basic interventions encompass techniques such as brushing and flossing. Comprehensive oral hygiene includes a broader range of approaches, including dental prophylaxis, regular checkups, and the prompt care of issues that impact the teeth and gums. Why oral hygiene matters. Dentists think of the mouth as a snapshot of a patient's overall. Although dentistry is a specialty that's separate from the care of the rest of the body, the two are unavoidably linked. It is clear that poor oral hygiene is linked to heart disease, tinnitus mellitus, liver and kidney disorders, and recent Alzheimer's disease as well. But while the case for good oral hygiene continues to strengthen, the public remains largely unaware of these new developments. Media messages that promote dental health as a social issue more than a medical concern contradict its importance to overall well-being. Each visit with a dentist or hygienist is a perfect opportunity for a dental assistant to educate patients about these critical issues. It takes time, patience, and top-notch communication skills, but the results are worth it. Analyses show that early intervention in oral hygiene makes a remarkable difference. Education topics for dental assistants. All oral care professionals play patient's education, but a dental assistant is typically a patient's go-to source for information. As the team member that greets and prepares patients for their professional services, they are ideally positioned to tackle issues such as brushing, flossing, nutrition. Brushing, as easy as it seems, most patients make at least one of several common mistakes that make brushing less effective than it should be. Errors include choosing the wrong toothbrush, not brushing long enough, using the wrong technique. Choosing the wrong toothbrush. Conventional wisdom once held that the stiffer a toothbrush is, the better it cleans. But dentists now know that softer bristles are better at reaching pits and fissures where plaque hide. Brushes with features such as angled heads and flexible handles can help patients reach tight spaces. Patients consistently have plaque build up in certain areas, a dental assistant can help them choose a brush that's better suited for their needs. Not brushing. The average American brushes their teeth for about 45 seconds, which is a far cry from the recommended 2 minutes, according to the American Association. This results in bacteria and plaque being left behind, potentially leading to cavities and periodontitis. Dental assistants can offer oral hygiene tips that help patients brush longer, such as using a toothbrush with a built-in timer and finding ways to make the brushing experience pleasurable. Some of today's toothbrushes for children even play a fun tune that lasts for a full 2 minutes. When the music stops, they know they have done a good job. Instead of brushing in long strokes side to side, a better technique is to brush in short, circular strokes beginning at the gum line where bacteria accumulate most. Dental assistants can demonstrate the proper technique, seeing how it's done, helps visual learners understand process better than a verbal description. Flossing. The American Dental Association reports up to 80% of plaque may be removed by this method. The American Dental Association recommends cleaning between the teeth as a part of one's daily oral hygiene regime. When food builds up in the spaces between teeth, it promotes cavities. Flossing is the best way to remove it, but it's time consuming, and for patients with tight teeth, it can be difficult. The good news is that dental floss has been reimagined in the last decade. New types address some of the common issues patients have with flossing, but many people are not aware these solutions exist. Dental assistants can help by discussing the types of floss available and the advantages of each. Using a model to demonstrate how floss should be moved along the sides of the tooth instead of just dragged in between rinses. Nutrition. Sound nutrition is the basis for overall health, but select strategies improve hygiene. Snacking on food heavy in starch, such as crackers, for example, leaves behind a sticky film that encourages the growth of bacteria, while overconsumption of acidic foods and beverages like coffee can erode enamel. Providing patients with a list of snacks and between meal beverages to avoid makes it easier for them to identify troublesome foods. Certain types of chewing gum cannot only mitigate the urge to snack, but they are also known to reduce the buildup of bacteria by encouraging the flow of saliva. That help muscles and bones also help teeth and gums. Vitamin C is necessary, for example, to prevent scurvy, which manifests as serious gum disease. Eating a balanced diet and limiting sugar intake can help prevent tooth decay and periodontal disease. The Federation Dentaire International has promoted foods such as raw vegetables, plain yogurt, cheese, or fruit as dentally beneficial. This has been echoed by the American Dental Association. Because dental assistants serve as chains between patients and dental professionals, they are in the ideal position to reinforce the importance of regular checkups and clinics. Just a friendly chat about timely oral hygiene topics while preparing the patient to see the dentist or hygienist sets the stage for further teaching. While they are waiting, informational handouts that detail what goes into regular checkups, in oral cancer screenings, gives patients something to think about and encourages them to ask questions. It takes only seconds to deliver powerful health messages that can last a lifetime. Pre and post procedure care. During a dental visit, patients should be informed every step of the way. Not only is it reassuring, but it also underscores the value of the service and ensures patients know what to expect. Whether a dental assistant is performing a minor procedure such as applying sealants or preparing a patient for an extraction, providing pre and post procedure care instructions is an essential responsibility of dental nurse. Dental services. In general, patients know less about advancements in dentistry than they do medical services. Patients with oral health problems are less able to identify potential solutions than patients with similar medical issues. They depend on their dental health experts to keep them educated of services. Tips for patient education. Effective patient education is a matter of both timing and communication. Patients are individuals with unique perspectives and different learning needs, so each deserves a customized approach. A dental assistant can make the most of limited time to give patients the oral hygiene education they need by being approachable, listening actively, making observations, asking the right questions, and identifying learning styles. Being approachable. Patients new to a professional setting are more likely to communicate and share their needs with approachable team members. A warm smile and friendly behavior encourage people to speak freely, while a lack of eye contact and a neutral expression are not welcoming. For dental assistants, building therapeutic relationships that define them as patient educators begins with an openness towards patients. Listening active. Communication best starts with a technique called active listening. Active listening is more than just hearing what a patient says. It's seeking to understand what they mean by considering both verbal and nonverbal communication. Body language speaks volumes. A patient who says she's comfortable with having her teeth cleaned but then pulls away from instruments as they come toward her mouth may have fears or concerns that should be addressed before proceeding. Making observations. An anxious dental patient may hesitate to ask questions for fear of appearing ignorant, but concerns are often evident in demeanor. Making a gentle observation about a change in a patient's attitude or body language can help bring attention to an issue by opening the door for discussion. For example, suggesting they seem hesitant to accept the dentist's recommendation for an extraction lets the patient discuss potential barriers from finances to fear. Observation is also an important tool when working with children who cannot yet communicate clearly. Watching for clues that indicate a child is fearful helps a dental assistant change approaches when necessary. Taking the stress out of dental visits allows kids of all ages to focus and be more receptive to teaching. Asking the right questions. In the interest of time, it's easy to fall into the trap of asking questions that require only yes or no answers. These types of questions are aptly called close-ended because they slam the door on communication. Open-ended questions, however, encourage patients to elaborate further. For example, asking a patient with persistent gingivitis if they snack between meals contains less meaningful information than asking them to describe what they have for snacks on an average day. The more data a dental assistant collects, the more likely it is they will accurately identify those problems and realistic solutions. Identify learning styles. Experts believe that students learn more when they taught according to style. As a patient educator, a dental assistant needs to understand how to best approach each individual. A combination of verbal and written communication works best for most patients. One reinforces the other. It ensures instructions are clear even if there is a gap in literacy. Hands-on oral hygiene demonstrations keep patients engaged and are particularly effective when teaching new techniques and working with children or the elderly. Assessing what patients learned is as easy as asking for a return demonstration. Oral hygiene items and products that should be presented to the patient. Toothbrushing. Routine toothbrushing is a principal method of preventing many oral diseases and perhaps the most important activity an individual can practice to reduce plaque buildup. Controlling plaque reduces the risk of the individual suffering from plaque-associated diseases such as gingivitis, periodontitis, and caries, the three most common oral. The average brushing time for individuals is between 30 seconds and just over 60 seconds. Many oral health care professionals agree that toothbrushing should be done for a minimum of 2 minutes and be practiced at least twice a day. Brushing for at least 2 minutes per session is optimal for preventing the most common oral diseases and removes considerably more plaque than brushing for only seconds. Toothbrushing can only clean to a depth of about 1.5 millimeters inside the gingival pocket, but a sustained regime of plaque removal above the gum line can affect the ecology of the microbes below the gums and may reduce the number of pathogens in pockets 5 millimeters in depth. Toothpaste is fluoride. Alternatives such as nanohydroxyapatite is an important tool to readily use when toothbrushing. The fluoride alternative in the dentifrice is an important protective factor against caries and an important supplement needed to remineralize already affected enamel. However, in terms of preventing gum disease, the use of toothpaste does not increase the effectiveness of the activity with respect to the amount of plaque removed. People use toothpaste with nanohydroxyapatite instead of fluoride, as it performs the same function, and some people believe fluoride in toothpaste is effective. Manual toothbrush. The modern manual toothbrush is a dental tool which consists of a head of nylon bristles attached to a long handle to help facilitate the manual action of toothbrushing. Furthermore, the handle aids in reaching as far back as it is wrapped cavity. The toothbrush is arguably a person's best tool for dental plaque, thus capable of preventing all plaque-related diseases if used routinely, correctly, and effectively. Oral health professionals recommend the use of a toothbrush with a small head and soft bristles, as they are most effective in removing plaque without damaging the gums. The technique is crucial to the effectiveness of toothbrushing and disease prevention. Back and forth brushing is not effective in removing plaque at the gum line. Toothbrushing should employ a systematic approach. Angle the bristles at a 45-degree angle toward the gums and make small circular motions at that angle. This action increases the effectiveness of the technique in removing plaque at the gum line. Pay attention to this diagram that represents the main stages of toothbrushing that can be demonstrated to the patient on the model.
The modified Bass technique of toothbrushing is used by patients that have good manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
Electric toothbrush. A toothbrush with moving or vibrating bristle heads. The two main types of electric toothbrushes are sonic type, which has a vibrating head, and the oscillating rotating type, in which the bristle head makes constant clockwise and anti-clockwise movements. Sonic or ultrasonic toothbrushes vibrate at a high frequency with a small amplitude and a fluid turbulent activity that aids in plaque. The rotating type might reduce plaque and gingivitis compared to manual brushing, though it is currently uncertain whether this clinical significance. The movements of the bristles and their vibrations help break up chains of bacteria up to 5 mm gum line. The oscillating rotating electric toothbrush, on the other hand, uses the same mechanical action as produced by manual toothbrushing, removing plaque via mechanical disturbance of the biofilm, however at higher frequency. So here you can see the variety of electric toothbrushes and magnified hairs of the toothbrushes that can be changeable. Technique toothbrushing. Using electric toothbrush is less complex in regards to brushing technique, making it a viable option for children, adults with limited dexterity. The bristle head should be guided from tooth to slowly, following the contour of the gums and crowns of the tooth. The motion of the toothbrush head removes the need to manually oscillate the brush or make circles. Types of floss include unwaxed floss, unbound nylon filaments that spread across the tooth. Plaque and debris get trapped for easy removal. Waxed floss, less acceptable to tearing or shredding, and used between tight contacts or areas with overhanging restorations. Polytetrafluoride slides easily through tight contact, does not fray. The type of floss used is a personal preference, however, without proper technique it may not be effective.
Introducing the interproximal brush floss pick, the Proxy Flosser, a revolutionary device that increases cleansing efficiency and reduces time spent on oral hygiene care for children and adults in orthodontic braces. The Proxy Flosser combines two cleaning features, an interproximal brush and a dental floss pick into one compact and easy-to-use device. The interproximal brush is passed in between the brackets and underneath the wire to clean these hard-to-reach areas. Simultaneously, the floss is passed between the teeth with upward movement of the device. This action allows for twice the clean in half the time. The Proxy Flosser is the solution for anyone who wants an effective and efficient way to maintain good oral hygiene while undergoing orthodontic treatment.
The correct technique to ensure maximum plaque removal is as follows. Floss lengths of 15-25 centimeters wrapped around middle fingers. For upper teeth, grasp the floss with the thumb and index finger. For lower teeth, with both index fingers. Ensure that a length of roughly an inch is left between the fingers. Ease the floss gently between the teeth using a back and forth motion. Position the floss in such a way that it becomes securely wrapped around the interdental surface and the tooth in a C shape. Ensure that the floss is taken below the gum margins using a back and forth up and down motion. So pay attention to this diagram that shows the ideal steps of how to do flossing of the teeth. This should be taught to the patient by dental assistant.
Here are the 5 steps to flossing correctly to keep your mouth healthy. First, wind about 18 inches of floss around your middle fingers. Pinch the floss between your thumbs and index fingers, leaving an inch or 2. Now gently glide the floss between your teeth. Then glide it around your tooth, making the shape of the letter C. Be sure to unroll the floss to a clean section as you go. It's that easy. Don't forget to floss daily with Oral-B floss to get a complete clean. Oral-B, brush like a pro.
Available options on the market. There are a few different options on the market that can make flossing easier if dexterity or coordination is a barrier as a preference of a normal floss. Floss threaders are ideal for cleaning between appliances, and flossetters are ideal for children and those with poor dexterity. Special flossetters are made for those with orthodontics. The Grip IT Floss Holder is an ergonomically designed dental flossing aid. Grip it holds dental floss very tightly so users don't have to pinch their fingers or put fingers in their mouths when flossing. This is very comfortable. Ideas for those who have braces or any other appliances that possibly can want normal flossing. Interdental brushes. They come in a range of color-coded sizes. They consist of a handle with a piece of wire covered in a tapered bristles. designed to be placed into the interdental space for plaque removal. Studies indicate that interdental brushes are equally or more effective than floss in removing plaque and reducing gum inflammation. They are especially recommended to people with orthodontics, often to use as well as floss. Pay attention to these pictures that show how to use interdental floss in patients who have braces and in a comparison between the use of dental floss, use of interdental brush, and toothpick. The steps in using an interdental brush are as follows. Identify the size required. The largest size that will fit without force is ideal. If necessary, more than one size can be used. Insert the bristles into the interdental space at a 90-degree angle. The brush back and forth between the teeth. Rinse under water to remove debris when necessary. Rinse with warm soapy water once complete and store in a clean. Replace when bristles are worn. So here you can see these pictures, techniques of how to insert interdental brushes between this space. Tongue scrapers. The tongue contains numerous bacteria which causes bad breath. Tongue cleaners are designed to remove the debris built up on the tongue. Using a toothbrush to clean the tongue is another possibility. However, it might be hard to reach the back of the tongue, and the bristles of the toothbrush may be too soft to remove the debris. Steps of using a tongue scraper. Rinse the tongue scraper in order to clean it and remove any present debris. Start at the back of the tongue and gently scrape forward. Be sure to clean the sides of the tongue as well as the middle portion. After the cleaning is completed, rinse the tongue scraper and any debris that is left behind. Rinse the mouth. Here you can see the variety of tongue scrapers and technique of how to do scraping of the tongue. Oral irrigation. Some dental professionals recommend subgingival irrigation as a way to clean teeth and gums instead of or in addition to flossing. Oral irrigators were first developed in 1962 as an alternative to dental flossing, also known as a dental water jet, typical dental irrigation. An oral irrigator uses a stream of pressurized pulsating water to clean between teeth and below. As a result, harmful deep periodontal pocket bacteria that could not otherwise be reached through brushing or flossing is flushed out and removed. Gum irrigation is indicated to patients who have sensitive gums, orthodontic braces, or non-removable prostheses for dental implants. Thus, interproximal cleaning with floss is complicated.
Brushing alone is not enough. If you just brush, food and debris get left behind. The Waterpik Water Flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into handle. If this is your first use, you'll need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik Water Flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth with the Waterpik Water Flosser.
Single-tufted brushes. Single-tufted brushes are a tool in conjunction with toothbrushing. The toothbrush is designed to reach the hard-to-reach places within the mouth. This tool is best used behind the lower front teeth, behind the back molars, teeth, and between spaces where teeth have been removed. The single-tufted brush design has an angled handle and a 4 mm diameter and a rounded bristle tips. So you can see magnified view of this single-tufted brush and how it works in the oral cavity. Gum stimulators. Toothbrushes with pointed rubber tips at the ends of the handles have been available for many years and have recently been replaced by a standalone tool called a gum stimulator, designed to massage the gum line and the bases of the areas between the teeth. Such stimulators help to increase circulation to the gum line and to clear away bacteria which might not be removed by brushing and flossing alone. Mouthwash. There are 3 commonly used kinds of mouthwash: saline, salty water, essential oils, Listerine, etc., or hexidine gluconate. Saline or warm salty water is usually recommended after procedures like dental extractions. In a study completed in 2014, warm saline mouth rinse was compared to no mouth rinse in preventing alveolar osteitis, dry socket, after extraction. In the group that was instructed to rinse with saline, the prevalence of alveolar osteitis was less than in the group that did not. Essential oils found in Listerine mouthwash contains eucalyptol, menthol, thymol, and salicylate. Cetylpyridinium chloride contained in mouthwash contains cetylpyridinium chloride found in brands such as Colgate, Lux, Crest, ProHealth, Oral-B, Rinse. In a meta-analysis completed in 2016, essential oils and cetylpyridinium chloride mouth rinses were compared, and it was found that plaque and gingivitis levels were lower with essential oils mouth rinse when used as an adjunct to the mechanical plaque removal, toothbrushing, and interdental cleaning. Chlorhexidine is an antiseptic mouth rinse that should only be used in 2-week time periods due to brown staining on the teeth and tongue. Compared to essential oils, it is more efficacious in controlling plaques but has no better effect on gingivitis and is therefore generally used for post-surgical wound healing or the short-term control of plaque. Appliances care. Dentures must be kept extremely clean. It is recommended that dentures be cleaned mechanically twice a day with a soft bristle brush and denture cleansing paste. It is not recommended to use toothpaste as it is too abrasive for acrylic and will leave plaque retentive scratches in the surface. Dentures should be taken out at night, as leaving them in while sleeping has been linked to poor health. Leaving a denture in during sleep reduces the protective cleansing and antibacterial properties of saliva against Candida albicans. And denture stomatitis, the inflammation and redness of the oral mucosa underneath the denture. For the elderly, wearing a denture during sleep has been proven to greatly increase the risk of pneumonia. It is now recommended that dentures should be stored in a dry container, right, as keeping dentures dry for 8 hours significantly reduces the amount of Candida albicans on an acrylic denture. Approximately once a week, it is recommended to soak a denture overnight with an alkaline peroxide denture cleansing tablet, and this has been proved to reduce bacterial mass and pathogenicity. Retainers. As with dentures, it is recommended to clean retainers properly at least once a day, avoiding toothpaste and using soap, and to soak them overnight with an alkaline peroxide denture cleansing tablet once a week. Hot temperatures will warp the shape of the retainer, therefore rinsing under cold water is preferred. Keeping the retainer in a plastic case and rinsing it beforehand considered to help reduce the number of bacteria being transferred back into the mouth. Braces. While undertaking the braces treatment, it is recommended to use a small-sized or specialized toothbrush with a soft head to access hard-to-reach areas. Brushing after every meal is highly advisable. Regular flossing is as important as brushing and helps to remove any plaque buildup as well as smaller food particles that are stuck in your braces or between your teeth. Floss threaders for braces or interdental brushes are also an option. Oral hygiene is increasingly recognized as an integral part of a healthy lifestyle, and it takes time to properly educate the patient. Despite dental assistants have many other responsibilities, so taking the time to teach each patient about proper oral practices is important. Overall, prevention is a better approach than addressing a problem once it has already taken root. So, practicing preventive approaches is an important aspect of maintaining a healthy lifestyle. References. The role of the dental assistant in your health can be accessed by this link. Oral hygiene education, a dental assistant's guide, can be accessed by this link. Dental assistants play a key role in patient health, can be accessed by this link. Thank you for the lecture, for being attentive, and have a good day.
In this video, we'll focus on patient care and communication. As a dental assistant, you'll work closely with patients to provide them with the care and support they need to maintain good oral health. Patient care is one of the most important aspects of your role as a dental assistant. You'll need to ensure that patients are comfortable and at ease during their visit, and that their needs are met throughout the appointment. This may involve providing blankets or pillows, explaining procedures to the patient, and offering reassurance and support. Effective patient communication is also essential. You'll need to be able to communicate clearly and effectively with patients to ensure that they understand their diagnosis, treatment options, and post-treatment care instructions. This may involve using visual aids or demonstrating proper oral hygiene techniques. Dental assistants also play a key role in handling patient questions and concerns. Patients may have questions about their treatment, their insurance coverage, or the cost of their care. You'll need to be able to address these concerns and provide patients with the information and support they need. Assisting the dentist during procedures is another important aspect of your role as a dental assistant. You'll need to be able to anticipate the dentist's needs, provide the necessary instruments and materials, and ensure that the patient is comfortable and at ease.
Another important issue that should be discussed on this lecture is managing patient dissatisfaction in dental offices. Effective management in dental office encompasses various responsibilities, one of which is addressing patient dissatisfaction. Dissatisfied patients can impact the reputation and overall efficiency of the practice if not managed properly. Dealing with patient dissatisfaction and receiving complaints are among the most challenging experiences a dental practitioner can face. A patient tells you they are unhappy with you and the treatment you provided. It is a heart-sinking moment, creating all manner of emotions, including frustration, reassessment, a fear of being overwhelmed, a feeling of being deprofessionalized, anger, helplessness, hopelessness, and powerlessness. These feelings, while understandable, are also unhelpful in formulating your response to this dissatisfaction, as you may react to the situation with emotion rather than respond in a professional manner. They are also unhelpful to you as they may lead to long-term stress, and the consequences of this for your physical health and emotional well-being are well documented. When we consider how to handle patient dissatisfaction or a complaint, our approach should be threshold. Resolve the patient's concerns, care for ourselves throughout the process and beyond, audit to safeguard against future complaints of this nature. Understanding the root causes of dissatisfaction. To manage dissatisfaction effectively, it is essential to understand its underlying causes. Common reasons for dissatisfaction in a dental office may include unmet expectations. Patients may feel the outcome of their treatment does not align with their expectations. Financial concerns. Unexpected costs or miscommunication about fees can lead to frustration. Delays or scheduling issues. Long waiting times or scheduling conflicts can erode trust. Perceived lack of empathy of professionalism. A patient may feel neglected if they perceive a lack of attention or understanding from the staff or a dentist. Pain or discomfort. Ineffective pain management during or after a procedure can heighten dissatisfaction. Principle of communication with dissatisfied patients. The foundation for resolving patient dissatisfaction lies in effective communication. Adhering to these principles can help. Listen actively. Allow the patient to express their concerns without interruption. Use nonverbal cues such as nodding to show understanding. Show empathy. Acknowledge the patient's feelings and validate their experience. For example, say, I understand how this situation might be frustrating for you. Maintain professionalism. Stay calm and composed even if the patient is emotional. Avoid defensive or argumentative behavior. Clarify the issue. Paraphrase the patient's concerns to ensure you understand their perspective accurately. Provide transparency. Explain any misunderstandings or miscommunications clearly without blaming the patient. Strategies for solving problems with dissatisfied patients. Once the concerns are understood, it is crucial to implement strategies to resolve the issue effectively. Below are actionable steps. Immediate response. Address the concern promptly. For example, if a patient is upset about a billing issue, review the invoice with them immediately. Offer solutions. Propose actionable remedies tailored to the specific issue. If a patient is unhappy with their treatment outcome, consider offering a follow-up appointment at no additional cost to address their concerns. Apologize sincerely. If the practice is at fault, offer a genuine apology. For example, we are truly sorry for the inconvenience this has caused. Involve the team. Engage relevant staff members such as the office manager or hygienist to collaborate on resolving the issue if necessary. Document the incident. Record the details of the complaint, the steps taken to address it, and the final resolution. This helps in tracking recurring issues and improving future processes. Follow up. After resolving the issue, follow up with the patient to ensure their satisfaction. This demonstrates commitment to their well-being and reinforces trust. Preventative measures. In addition to reactivate strategies, corrective measures can help minimize patient dissatisfaction. Set clear expectations. Provide detailed explanations of procedures, costs, and potential outcomes at the initial consultation to ensure patients are fully informed. Enhance communication. Train staff to communicate effectively and enthusiastically with patients at every stage of their visit. Regular feedback. Implement surveys or suggestion boxes to gather patient feedback and address concerns proactively. Continuous staff training. Ensure all team members receive ongoing training in customer service and conflict resolution. The key points that should be memorized of how to manage irritated and dissatisfied patient. For the first time, and the most important, please provide empathy. Provide clear communication to the patient, and in the case of occurrence of the problem, be effective in the problem solving. Provide time resolution to the patient's issues. And next steps that can be suggested to the dental office staff of how to manage anxious, dissatisfied patient. Assess current practices, implement communication training, develop a dissatisfaction management plan for the future. Strategies for building trust with dental patients. Trust is essential in the dentist-patient relationship, but establishing trust is not always easy. The most important tool healthcare providers have to build trust with patients is communication. Oral health-related quality of life is significantly influenced by the level of trust and communication between dentists and patients. Here are some tips on how to communicate effectively with patients and why communication is important. How to build trust. Clear communication can build trust, but how information is communicated can be just as important as the information itself. Empathy and kindness can improve communication and help build trust, as can managing expectations and ensuring that patients have a say in their care. Ultimately, building a healthy relationship with patients has the potential to improve the quality of care. Be empathetic. Empathy is fundamental to building trust with patients. The simple act of imaging what another individual is experiencing can offer a new perspective on how to best care for an individual. Another aspect of empathy is emotional intelligence. Understanding a patient's emotional state and behavior can better guide the ongoing conversation. Set clear expectations. A disparity between expectations and reality harms any relationship. Asking patients about their expectations before treatment gives you a starting point to shape how they perceive their care. Explaining and demonstrating procedures and educating patients about their oral health can ease anxiety and uncertainty. Ensure patient engagement. Patients should be involved in making decisions about their care. Presenting them with options is important, but they must first be educated about those choices and the potential consequences. Clear communication allows for informed decision making. Build relationships. Establishing a rapport with patients involves building relationships. Proper dental care requires repeated dental visits for routine cleanings and dental procedures, so making patients feel safe, comfortable, and well cared for is an important part of maintaining continuity of care. Patients and dentists must work together as partners to achieve the best outcomes. Use teamwork. Building relationships with patients should involve the entire treatment staff. Patients should feel like they have as important a role in their dental care as the dentist, hygienist, and technicians they deal with. Good communication fosters trust. Building trust requires effective two-way communication between dentists and patients. Trust is important in the dentist-patient relationships as it provides effective dental care. In conclusion, using effective verbal and nonverbal communication can improve patient satisfaction and health outcomes. Mutual understanding between a dentist and a patient can help provide the best possible care to meet that patient's specific needs. Perhaps more importantly, clear communication allows patients to become informed participants in their care. Research has found that good communication improves patients' experience with dental care. Specifically, people who receive well-communicated health education from their dental providers have a better self-reported health status and increased satisfaction with the outcomes of their dental care. Other research has shown that patient trust in dental providers plays a significant role in oral health-related quality of life. Research shows that the quality of communication affects patients' trust, satisfaction, and anxiety levels. In this study, patients who experienced previous positive communication with their dental providers had better oral health literacy, higher satisfaction with their care, and less mistrust. Meanwhile, patients who had a negative experience communicating with their dentist had more anxiety and dental mistrust. Handling dissatisfied patients requires a combination of empathy, clear communication, and effective problem-solving strategies. By understanding the causes of dissatisfaction, applying the principles of communication, and implementing appropriate strategies, dental offices can turn challenging situations into opportunities to strengthen patient relationships and enhance the overall patient experience. Thank you for your attention. Wish you a good day.